Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Hi, Dr. Luper.
Hello, Haley.
Well, last episode we started off our autoimmune investigation with Raynaud's syndrome, and that got me to thinking of other circulatory issues, something that,
Autoimmune type stuff.
Yeah,
we kind of poked at that one.
Yeah.
Right?
So another one that kind of similarly aligned with Raynaud's, I thought would be rheumatoid arthritis.
Yeah.
In the sense of the achy joints and the
They're
inflammation.
Raynaud's is a symptom of rheumatoid arthritis.
Wow, okay.
So we started that conversation a little bit and then just kind of poo-pooed it and went off into more of the treatment of the Raynaud's. But we should go back and talk about the real treatment of rheumatoid arthritis.
Sure, yeah. And does Raynaud's is that a precursor for rheumatoid arthritis?
Well, that's a good question. It can be. And it's a sign that the immune system isn't working right because the immune system is affecting the nervous system. And so the nervous system is causing this normal reflex of decreasing blood flow to the limbs when you get exposed to cold. That's normal, by the way. Except for it's exaggerated.
But it's excessive, yeah.
It's excessive, so
Yeah.
It turns out to be excessive. Well, there's a lot of excessive stuff that happens in our bodies when we have rheumatoid arthritis. One of the main ones is our joints become damaged by white blood cells.
So the white blood cells are hyperactive.
Yep.
And attacking specific areas.
Yep.
The joints.
Yep, that's right. That's exactly right. So let's talk about rheumatoid arthritis. Rheumatoid arthritis, there's different kinds. There's a juvenile kind, there's an adult kind. I don't want to get to too much detail in this one. Let me give kind of the general characteristics of all rheumatoid arthritis. Rheumatoid arthritis is a disease of the joints that causes the joints progressively to be destroyed. And the classic joints to be destroyed are the joints in the hands. And so what happens is the fingers will bend over and you get this kind of bent to the side finger thing where your hands don't work right. They're basically become crippled eventually. And you have no grip and it hurts like heck. That's the other thing. It causes a lot of pain.
Is another symptom of rheumatoid arthritis like low grip strength initially? Like
Yes.
while they still have the ability to...
Yes. Now, any kind of pain is going to cause low grip strength.
Sure.
So there's that. It's a source of pain.
Even without pain.
Even
though.
without being rheumatoid arthritis, it still can cause low grip strength.
Yeah.
Other things can too as well, but the pain is a key feature of this. Now, the hands are not the only joints in the body that are affected. They're the ones that show the most. Somebody walks in, I can see they have rheumatoid arthritis, before they sit down.
I'm thinking of our previous patient
That's right.
in the wheelchair.
That's right. We saw one recently.
Mm-hmm.
And the other joints are affected. Any joint in the body can be affected by this disease, but the leg joints are commonly affected.
Knee joints.
Hip joints.
Hip joints.
Yeah, the whole thing.
The back, joints that are used the most, it sounds like.
Big weight bearing. Yeah, the back can be affected as well. If the back is affected, a lot of times it's the disease is different and manifests in a different way, and it's known as ankylosing spondylitis. They're in the same category. They're not the same disease. The process is not exactly the same, but they're both autoimmune diseases. And again, I'm getting too technical. I don't want to do that. Let me go back to the big picture. The white blood cells are overreactive. That's the problem. So now you think, okay, my white blood cells are overreactive. How do we fix that? We better calm those white blood cells down. Mm-hmm. And that is the focus of treatment for rheumatoid arthritis.
Calming the immune system.
Bunches of drugs that are available that will calm down. Is that the right word? Shut down. That's a better word. They'll shut down the immune system. The classic one, the first one that was used, it was a miracle cure when it first came out, was cortisone. So if you do a cortisone shot, it shuts down that inflammatory process. It puts all the white blood cells back to sleep, and the pain goes away, and they don't have rheumatoid arthritis anymore. It just clears it out of their system as long as the cortisone is in action.
So how long does the cortisone stay in action for?
If you're lucky, a few months.
Okay.
If you're not, less than that.
So the more you get these cortisone shots, the less effective they are?
Well, that's part of it. The more important part is the cortisone also shuts down the body's ability to heal and repair.
Yeah.
So this inflammatory process, we need to have a certain low-level amount of inflammation in our body in order to fix the stuff that needs to be fixed. So the cells that go in and fix things are cells that are likely to go in and kind of saw out a little section that doesn't work quite right and then put in a new one, or cut off a little edge of something that's a little rough and kind of put a nice spackle a new one in. And these are basically carpenter cells. Mm-hmm. And they go in and they remodel us. Mm-hmm. And the cortisone shuts them down. Now they don't work. There's no remodeling. And what will happen is you'll fall apart. So cortisone was touted as a miracle cure and the most fabulous drug, at least for people who have this or doctors who treat it, until they played it all the way out, and 2 or 3 years later they were cursing the fact that anybody had ever invented this, because it was a life wrecker. Because not only did the joints that were affected by the arthritis be affected, because the cleaning needed to take place from head to toe, but all the joints did, all the bones did, all the connective tissues, the healing that was taking place in your entire body shut down. And it turns out the cure was much, much worse than the disease. Because people will fall apart. Mm-hmm. It led to much pain, much misery, and much death. And pretty much, more or less, the cortisone has been sworn off as a treatment for rheumatoid arthritis. Because if you play it out, it doesn't work. Now, in the short run, it works beautifully.
So has it kind of jumped back from injections to more so like cortisol cream?
Could be, yes. Yeah. That doesn't work near as well.
Yeah.
So the way cortisone works now is that the people who come in and they're hot and they're painful and they're falling apart and they just feel horrible, they'll come into a doctor, rheumatologist typically, and the doctor will start them on some sort of medication that'll calm their immune system down and give them cortisone. And the cortisone shuts the disease down, and they are better in a day. And they think, oh, I love this doctor. He's fabulous. He saved my life, right?
Right.
Now, when it wears off, the other medication kicks on, and now you have control over rheumatoid arthritis. Now, the problem with this, though, is the medications that shut down your immune system, well, they're shutting down your immune system.
Yeah, and you need your immune system.
You need your immune system.
Right, so you pick up bugs, and you pick up bacteria, and you get sick.
Have you seen these advertisements on TV? I hardly ever watch TV, so I never see them.
I don't.
But I've been in a hotel room, and I flip on the TV because I'm in a hotel room. I was like, how exciting! I got to watch TV, right?
Cable.
And I'm captivated by the ads. And there's these happy people playing baseball or digging in the garden, and the disease, the drug is some sort of it's a biologic, is what it is, for rheumatoid arthritis. That's there's lots of these drugs around, but the ones that I'm thinking of. Enbrel is an example of this, and everybody's so happy, and in the end they say this may cause, and they give a long list of things that it'll cause, mostly infections and death and despair and organ failure, right, from this disease. But very quietly and very fast said. Yes. Meanwhile, people are enjoying their happy lives right on TV. I always kind of creep me out.
Yeah.
That. It seemed like the cure is worse than the disease kind of thing. Exactly. For some people.
Right.
For some people. Now, most people don't get all those horrible side effects. And so the majority of people do well. And these drugs have been beneficial to society overall.
But it does seem counterproductive to shut down somebody's immune system who has an autoimmune disorder.
Do we have to?
Yeah. Do we?
No.
Yeah.
We don't. It turns out there's other things that we can do. There's other ways to treat this. If you think about it logically, which is your immune system, I'm assuming, just for the sake of argument, I'll talk to you because you don't have rheumatoid arthritis, but let's
hopefully
say you do.
not.
Yeah. What we want to do is we want to calm your immune system down. Mm-hmm. And so how do we do that? Well, we need to find out why it got jacked up to begin with.
Yeah, where the infection is, where...
Chances are you have an infection. Mm-hmm. It could happen. You could have a hidden infection. Easy. Then
so
you wouldn't
then
even know.
Run tests, markers.
We should check.
Yes.
Let's see if you have an infection. We're going to check and see if you do. If you do, bingo, we're going to start right there.
So you're going to do
We're not going to
the-
shut your immune system down. We're going to shut down the thing that got jacked up to begin with. And so now the question is, where would you have a hidden infection?
I would think in the gut because there's a lot of surface area in that.
That's your biggest hidden part.
Yes.
Big old long tube. What?
Yeah.
15 feet long, right?
Right. With lots of little nooks and crannies.
Could be packed full of some nasty, horrible bacteria.
Yeah.
Likely
from
is.
Who knows when?
You eat too much pizza, and there you are. You got some infection in your gut, right?
Yeah.
Yeah, it could also be in your sinuses. Could also be, I don't know, vaginal? It's possible.
It's possible.
Right? More likely gut.
Yeah.
What, 90, 95, 98% of these infections are gut related is where they are.
Okay.
And so what we do is we run a test to figure out what kind of gut infections you have. It's not a regular test. Those they're called an O&P, they look for pathology. And a lot of times people don't have pathological organisms. They don't have, salmonella or some kind of horrible strain of hemorrhagic E. coli or the things, C. diff, the things that'll kill you.
Right.
You think, well, that's what it's got. No, it doesn't. It's not those things. It usually isn't. If you did, you'd be sick as a dog and having diarrhea and puking up, right? No, it's going to be something that's subtle, something that kind of borderline lives in us already, that for most people it's okay, but for some people it doesn't work out real well, like a strep infection in your gut or a staph infection in your gut or Prevotella, or who knows, something like that. Candida, it could be a fungus, something. Well, we all have Candida, don't we? Yeah, except for some people have it bad and it causes a problem, and other people don't, and they don't have a problem. So now we want to figure out what the problem stuff is. It's not if you have it, it matters, is it a problem? So you do a combination of tests. You test for the good bacteria, the bad bacteria, and you look at the overall pattern. You get, from at least me, I could get a pretty good sense of what's going on in people's guts. I also want to look at their immune system and specifically run tests to see how jacked up someone's immune system is. Now, there's a couple of standard tests for rheumatoid arthritis. There's a rheumatoid factor, an RF, right? You can run that. It's not always positive in people with rheumatoid arthritis, but mostly is. The other one you can run is anti-CCP, and that one's together between the two of them, they cover a lot of ground. You get a pretty dang good sense of whether somebody has rheumatoid arthritis or not. You also run a C-reactive protein. That's not specific to rheumatoid arthritis, but it'll be up. You run a sed rate, same things. It's not.
And those would be kind of like the
specific.
first two tests that you would run, and then go deeper if those markers were elevated.
A lot of times, that if I didn't know and I wasn't sure what kind of arthritis somebody came in, they came in and say, I got this ankle thing. It kind of hurts. And I ask them questions, and it's not hot, it's not swollen. Who knows? It might be osteoarthritis. I'd start off by running C-reactive protein and sed rate just to see if it was inflammatory to begin with. And then if it turns out, whoa, look, it's inflammatory, I'd run these other autoimmune markers, ANA, whatever, stuff like that. And then but a lot of times people come in and there's a distinct pattern. The pattern is bilateral, swollen, hot, painful, particularly it's a kind of a rusty gait painful, which is, it's worse in the morning, and then as the day goes on, you kind of feel better.
Sure.
And that's classic for rheumatoid arthritis, because as you go on, the immune system calms down a little bit because you're using it, and you wake up super stiff. Those are classic. If somebody shows up with that, I run the rheumatoid test right off the bat. Okay?
Yep.
Okay, so I have to be careful. I can get so much into the minutia of doing the diagnosis and all that. I'm not trying to teach everybody listening how to be a doctor and how to think about this. What I'm trying to do is give y'all some sense of how to think about the disease and how to get at the roots of it, and also some actual practical things that you could do to calm your immune system down.
So you, in this practice, have seen plenty of rheumatoid arthritis.
Yeah.
How do you treat it?
Okay. We started the treatment already, which is find what's got people's immune system jacked up to begin with. Even if I was, not say I would, but even just for the sake of argument, even if I was going to put somebody on an immune system blocker, I'd still want to do the lowest dose I could to have it be effective. So I'm going to want to calm the immune system down whatever other ways I can so that I get the least amount of side effects. Now, we don't want to take your immune system and turn the dial let's say at 12, right? This is a 1 to 10 dial, and you're at a 12. Your body's freaking out, right? It's wrecking stuff. We want to turn it down to what? A 6? Mm-hmm. Not a 0.
Yeah.
Or not a 1.
Right.
We want some action so you can find an infection.
Yeah, maybe like a 6, maybe a 5.5.
Yeah, something like that.
Yeah.
So now the question is, what is there in the world that'll calm immune systems down? Haley, you and I have done this show a fair amount of times. I think at this point you might have an idea or two, stuff you can take.
Yeah, we do this anti-inflammatory.
Yeah. What do you think?
concoction.
You give me some ideas, and I'll say if they're good or not, and then I'll also give you some ideas. I'll add them some stuff.
Well, glycyrrhiza, curcuma.
Okay, wait, one at a time. Glycyrrhiza.
Yes.
That is
licorice.
licorice root. Yes, you are exactly right. And the reason why licorice root works so well is because, first of all, it's an anti-inflammatory.
Mm-hmm.
You go, why is it anti-inflammatory? Because it stimulates your adrenal glands. And your adrenal glands regulate your immune system. They are in nature the way your immune system is regulated. You ever think for a minute, why does that cortisone work so well? Remember that used to be the miracle cure back in the 60s when they first started using it? What's the deal with that? Because cortisone is what's made by your adrenal glands.
Yeah.
So you were simply adding more stuff that your adrenal glands would normally make to dial down your immune system. Remember, we dialed it down too much.
Right.
So if you got just the right amount, you could dial it down appropriately. How do you do that? Well, you could use very tiny doses of cortisone. That's possible. Except for now, it's tricky. But can we just use an herb? Is there an herb we could do that we don't have to worry about it so much? Bingo. Yes, there is. Licorice root.
Licorice root.
Glycyrrhiza. That's one word.
Mm-hmm.
Isn't it interesting? It turns out it's like cousins
To cortisone.
to the cortisone.
Yeah.
Who would have thunk?
That's beautiful.
Okay, what else?
Curcuma.
Yes, curcumin, or curcuma is the Latin name for it. This is turmeric, is what it
Turmeric.
is. And that is an absolute fabulous anti-inflammatory. More research, I think, of any herb that there is on the planet has been done on curcumin. Curcumin is the so-called active part of turmeric, except for when they were pulling the curcumin out of the turmeric in India, because that's where they grow it, and selling it to the manufacturers to put in capsules, they had tons of this leftover stuff.
Sure.
That wasn't curcumin. And so some researchers thought, I wonder if this stuff is worth anything either. And so they started doing tests on it, and it turns out it's fabulous.
Yes.
So it's not just the curcumin part of it, it's the whole plant.
Yes, absolutely.
The entire kit and caboodle works. So that's how we use it.
Yeah.
Our stuff, even though it's called curcumin,
The
that's the Latin name.
extract, yeah.
It's an extract of the whole
Of
plant.
the whole plant.
Yeah, and it's a good anti-inflammatory. Now, it's not the cure for rheumatoid arthritis in and of itself, but it is an absolute contributing factor to calming people's immune systems down. And it really does work. It actually does something. And the other thing is, the more you take, the better it works. Now, eventually you take enough of it, it's going to get a little on the hot side. So there's that. So you have to be careful, like how much curry you can eat, right? So there's that. But if you add a little heat to it, a little hot pepper added in with it, it works better. In fact, the way you get it, if you go to the grocery store and buy curcumin, it comes in a capsule, then they mix black pepper in with it because the absorption is better if you have a little bit of heat added into it.
Okay.
Now, it works even better still if it's mixed with oil. That's the stuff we have in the shelf.
Right.
The curcumin phytosome is mixed with lecithin, which is oily, and so the absorption is much better. You get a much better bang out of your buck. Well, I mean, better in how much? 30 times better?
That's
Seriously,
substantial.
a lot.
Yeah, that's a
Like,
lot.
the difference between, I don't know, curcumin doesn't really work. It kind of works, maybe, right? And then I can't believe how I lived without this stuff. You want to get the stuff that's got the oil in it, the lecithin in particular. That's the most effective part. There's other ways to do this as well. I'm not trying to pitch any particular product here. Just
Sure.
generally speaking, you want to use the kind of curcumin that's absorbable. In fact, let's just kick this around a little bit more because this is interesting. The Indians in India have much less cancer, much less autoimmune disease, much less rheumatoid arthritis than we do here. It's not unheard of.
They're using
but
a lot of turmeric.
in their diets.
Yeah, and licorice.
And licorice.
Fennel.
And fennel.
Yeah.
And spices in general, because that's
Yeah.
these spices grow in India because it's a
Sure.
a tropical, semi-tropical country. And so the way they eat it, and this is a classic way to eat curry, is you take some oil, pour it in a pan, or ghee, which is clarified butter, and then you take the spices. Usually you throw an onion there and fry it up. And then you take spices, and then you dump them in with like tablespoon worth or 2 or 3.
Follow your heart.
And then you scrape it around and you cook it in the hot oil
and
until
bloom
it blooms.
Mm-hmm.
And the sharp kind of smell softens and becomes different. And
aromatic.
It smells better.
Yeah.
And you go, oop, now it's ready to eat. Now you can take that and put it on vegetables or rice or whatever, and you make curry out of it. Add some coconut milk, and you get, kind of like a creamy curry. And then you get this thing by cooking the spices. Now, when you cook the spices, you're putting oil in with them, and now they're way more absorbable than they were before. It turns out the Indians had already solved this problem.
And when you cook them, when you heat them, does it lose some of the helpful properties?
No.
Okay. It enhances?
Good question.
Does
yes,
it
enhances.
Okay.
You get more out of it. There may be some of the volatiles that are blown off, and there's this and that goes, but what you lose is a fraction of what you gain. You gain way more than you lose by cooking the spices. Not all spices are that way, but most of them are. If you cook them, they're better. Honestly, when you really get down to it, most food is better if you cook it.
Yeah.
Because it's easier to break down. Now, you are losing some nutrients in it, vitamin C especially. So vitamin C is better if you eat foods that are raw. But if you want to actually get nutrition out of them, minerals and vitamins and those kinds of things, if you cook it, you're actually going to get more out of the food than if you didn't. Now, we're not talking cooking it to a pulp.
Yeah,
we're not turning it into a puree and the little charcoal briquettes that are left over. Those don't really have that much.
You're heating
the minerals are left, and that's it.
Yeah. So another herb that we use to treat inflammation is Gandoderma or reishi.
That's right. Yeah. That's another good one. Yeah, very good. It's mushrooms. Mushrooms in general are helpful. Reishi mushrooms particularly helpful. It's more helpful for per unit volume than the other mushrooms are. Here's the thing about mushrooms. The stronger the mushroom smell, the better the mushroom effect is of calming your immune system down.
And going back to the cooking concept, when we heat mushrooms, are we taking
Not
away?
breaking it. No,
Okay.
no. We're enhancing again.
Perfect.
Is what we're doing. Yeah. So my favorite mushroom now, even though I use Ganoderma all the time, and it's a staple in our practice.
That's your favorite mushroom.
I use it all the time. But actually, I've been using cordyceps.
Oh, yeah,
more.
that is your new favorite.
And that's my new favorite. And if I want to do really super high dose stuff, I'll use the cordyceps.
And so the cordyceps, does that also suppress immune response?
I'd say word regulate. It's not really suppressing. It's lowering it down, but it's really coming up with a regulation, because people who are too low, it'll bring it up, and people too high will bring it down. Licorice root does the same thing. If it's too low, it brings it up. If it's too high, it brings it down. Another one that you haven't heard, we haven't talked about, is Eleutherococcus. It's Siberian ginseng. That's another one. If it's low, it brings it up. If it's high, it brings it down. They're called adaptogens. And they'll fix it on both sides. What a great trick that is.
Yeah.
And so that's Siberian ginseng is another one that we can use with this.
Something beautiful about herbs. They do hundreds of different things.
Yeah. Okay, so a zillion different kinds of herbs that we can use. What else?
What about L-glutamine?
Not for this one. L-glutamine is very helpful to build up the lining of the digestive system.
Yeah.
If it's leaky, and that's one of the reasons why stuff is coming in and irritating the immune system. Glutamine can be used. I put it in a B list and not an A list. It's indirectly calming to the immune system, but not directly calming the immune system.
Well, we have these supplements on the shelf. Osteoprime Forte, Osteoprime Ultra. So when I think of rheumatoid arthritis, I think of joints. And then
No, you're exactly right.
Bone.
That's a very. I'm glad you brought that up, because that's something I wanted to talk to, and I want to address that before the show is over. So we're going to put the immune calming stuff on the back burner a little bit and talk about what else can we do to help people with rheumatoid arthritis. Kind of calm down. I've so much I want to say. I want to speed. So what the problem is the immune system causes white blood cells, as part of the immune system, to attack the connective tissues, break them down, blow little holes up, like releasing chemicals, and shred the connective tissues, have them fall apart. Okay, so now we got pain because there's destruction going on. I'm sorry to be so graphic, but on a microscopic level, that's what's happening here.
Yeah.
So if we could spackle that stuff up, if we can kind of knit it back together, if we could get it to grow back together quicker, better, faster, then we're going to get some ground on this thing. And you can. There's stuff that you can take that will help heal your joints. The two most favorite ones I use are methylsulfonylmethane, otherwise known as MSM, and that's a sulfur source, and it's a goo source, and it basically adds goo to the joints and lubricates them. The other one is glucosamine.
Okay.
Glucosamine is a constituent of cartilage, and a lot of times cartilage is what's being damaged here. And so there's a protein that holds the goo in place, and that's largely glucosamine. So if you add glucosamine and MSM, you can heal up some of the damage. Now, here's the rub. The rub is, if the damage is super slow, these molecules can gain ground, like with osteoarthritis. I imagine, if you will, a river. There is this placid, the Mississippi just kind of flowing along in the summertime, and you're in a canoe. The canoe is MSM and glucosamine, and you're trying to get upstream, and so they're paddling, and they can go upstream. They can't go very fast, but they can make their way up, and you get better and better and better and better, and the symptoms go down. I know the metaphor kind of is weak here, but rheumatoid arthritis is a raging torrent.
Sure.
And you can paddle like crazy, and you get blown out, right?
Yeah.
So they have a less of an effective role in treating it, and yet, if you want to gain ground as best you can, they're cheap, they're easy to take, and if you can slow down the flow of the river of destruction down to a low flow, you can actually start making headway and heal your joints back up.
Okay.
Now, your body's going to do this anyways, but slower yet. Now the question is, can we speed that up? Because it's super slow.
Yeah.
And the answer is yes, we can. We could speed it up by taking glucosamine and MSM. We can also speed it up by taking anti-inflammatories. We talked about a bunch of herb anti-inflammatories. Proteolytic enzymes, bromolin's the most famous one. It was one invented first. It was extracted from pineapple and still used today. But there's more effective proteolytic enzymes. The one that we use mostly is wobenzyme.
Oh.
That's what that's for.
Oh.
That's an anti-inflammatory that works very well with people with rheumatoid arthritis.
Wonderful.
Okay? And it works. It really does. It helps. And it helps heal. And then what we want to do is we also want to improve blood flow.
Yes.
And we talked about that in the last show when we talked about Raynaud's, how we do the hand thing and the hydrotherapy. You put your hands in the hot water, and then you put them in cold water, and then you go back and forth. And by doing that, it causes the blood vessels to dilate in the hot water and then to constrict in the cold water. So you get dilation, constriction, dilation, constriction, dilation, constriction. And then last thing you go is in the cold water, and you pull them out, and they dilate. And now there's more blood flow. Your hands are warm. They're more vital than they were before. Everything's working better. And so the healing improves. Now, here's the thing. If you're not doing anything to calm down your immune system, then your immune system's going to improve as well. You're going to get more damage from the immune system. So this hydrotherapy is important as a tool, but you have to use it in the right place at the right time. You cannot do it when you're flaring. It's a bad idea. You have to do it between flares, or if the flares have been stopped and you're just getting better now. So, it's a useful tool. I want to mention it, especially because it dovetails nicely with the last show that we did.
Right.
Yeah, this hydrotherapy thing is a useful thing to do as well. Any other questions?
I don't know if we have enough time for all of the questions.
Let me add one more thing. There's another thing that I find to be useful is if we can get the adrenal glands up and running better and making more stuff, then they regulate the immune system well. And there's more things that we can do to help with that one. One is this product that we have. It's called Adrenal.
Right, the ground adrenals.
It's got ground up adrenal gland in it, and it's got a bunch of herbs in it. We talked about the herbs already, but the ground up adrenal gland, turns out ground up adrenal gland is very helpful. If you
stimulating the adrenal gland.
Yeah, if you feed the adrenal glands ground up adrenal gland, they tend to know what to do with it. They make stuff. They tend to be more functional. And there's another thing. There's a hormone that the adrenal glands make. It's a hormone precursor. It's not really a hormone. It is a hormone, except for it hardly does anything. It's called DHEA, dihydroepiandrosterone. It's a precursor to other hormones. Testosterone can be made out of it. Estrogen can be made out of it. A bunch of, like 60 hormones can be made out of it downstream. And so if you can get it at the grocery store or at the health food store, and if you take a decent kind of lowish dose, a full-blown dosage of it runs 200 milligrams.
Right.
But I mostly use it at 50. You know that because you're the ones helping me with this. I'll do 50s, 25 maybe, sometimes 100 if I'm really pushing hard, as a way to kind of get hormone levels generally to go up. The hormones tend to help regulate the immune system. So that's another safe, easy thing to do to kind of fit in if we have a case that's running a little slow. It's not churning as fast as we want. So it's another thing to consider. Okay?
That's plenty.
All right.
That's wonderful. Thank you so much.
My pleasure.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.